There's different types of attention deficits, but when you're talking about boys and girls, what do we have all this confusion about? Well, I did a little bit of research, and basically, girls, they might be viewed as having personality traits or characteristics. So a girl that might have an attention deficit might be really, really talkative. They talk and talk and talk. That could be the hyperactivity, but it's just in a different way. And they just might be viewed as, your typical chatty Cathy. But what about your messy child, disorganized child? What about other things like being rough, not doing the typical girl thing, the tomboy? That too can be an attention deficit. So as a girl, these might be just personality traits, but in actual fact, they're attention deficits or characteristics of it. Then when it comes to the other side of attention issues, such as quiet, withdrawn, not following directions, daydreaming, looking out the window, well, that's also just a girl that's being really shy and quiet. And this is how girls can be missed. That's part of the reason. It just shows up differently. If boys have a hyperactivity, they might take that to the next level and it might be a little too aggressive and it's causing issues. And that draws attention. And that's why boys might be more apt to have that diagnosis than girls. Another factor that's to consider is that girls do tend to mature a little bit quicker than boys. So when you do the comparison and you have a boy with an attention deficit possibly in the room and a girl, you may not view them as having the same concerns. Girls can also camouflage the issues by working harder, being that perfectionist, just trying to fit in and not feel like they can't attend. So they work twice as hard to try to keep the attention deficit manageable. And that might also lead to the attention deficit being missed. They struggle inside just like boys do, but they might just keep all those issues inside where boys are more apt to release it. And this leads to the next concern. We tend to pick up on with girls, instead of the attention issue, is actually the other symptoms of attention issues, which can be anxiety and depression. Those are the factors we picked up on, but we don't get to the root problem of why those things are surfacing, which is the attention issue. Now I'm going to leave you with a few facts. This is from actually Patricia Quinn, a doctor. She says the average age of diagnosis for women with ADHD who weren't diagnosed when they were a child is 36 to 38 years old. And before that time, they're often misdiagnosed as having a mood disorder or an anxiety disorder. And even if these are secondary conditions, treating them doesn't take you to the root problem, which is the attention deficit. So I want us to look at things like the quiet girl, even the way we label tomboys and chatty Cathys. Is there something in that? Are we missing the perfectionism that is actually based out of attention deficit? So let's start looking a little bit closer and try to address the real issues versus the other issues that pop up, like the anxiety and the depression in women and girls. I will be chatting with you next week.